Dr. Amalo Anderson.
Yeah, go ahead.
Hi.
Can
Hi,
hear
it's
you.
yeah, I'm not on camera. I don't have that ability to say where I am at. So I want to
Oh, okay.
say what a wonder it's Mr. William Power. What a
Okay.
wonderful information. And it just what you pointed out, and it just opens me up even more to a saying that I've come up with, and that is we have mental problems because of mental policies and mental government and mental guidelines and mental laws. Imagine if it was the opposite, you know? And I think what you're doing with the community is a wonderful thing because that's the start. You're already getting results. You're in 3 of the communities or districts, and you got 25 more to go. And I just want to encourage you with all kinds of power and love to continue that work. I do you need what kind of help do you need from the rest of the world to to accomplish this sooner than later? To have these little groups to train these people that go into these districts or communities that are making a difference. What is it that you need?
Yeah, I think we are lacking some of the equipment. For example, uh, like I said, we have 28 districts, and we are only targeting 3 districts because we can able to reach people within those districts because they are near our offices. But for those who are far away, it means you need maybe a vehicle. For example, situation like emergency situation where it is happening far from your area. It means you have to book a taxi to go into that area because we don't have an emergency vehicle which can take us where to help someone who is far from us. And again, for the trainings, for example, per district, we were assisted by a certain international organization with the 30,000 US dollars for 10,000 each district, and it helps us to train those uh, champions within the district who are now doing the commendable job of counseling and also meeting people, trying to influence the cultural understanding on mental health, and also working hand in hand with the government. Because what we do, since we are some of them, they are not professional medical doctors, we do work in hand with the government. So, for example, in the district or in the community, they have what we call community health centers. So, in those community health centers, if a counselor in the community has a problem which is beyond him or her, it means he's supposed to do a referral to the government hospital. So we also lobby for the government to give us at least one mental health doctor in each uh, um, district where we can able to work hand in hand with them to share information and also do a referral work. So for now, we are limited because that grant was only to cater for those districts. And we are just trying to do some fundraising where we can get more resources to reach out into other districts. The only challenge with our government, politicians in Africa, they are only concerned by themselves. Once they are elected, they will be you. be just hearing cases of corruption, taking money, issues of health. They don't care. If people, they will be dying, but they will not care. You can see the numbers of people who are dying here in Malawi with suicide issues, but the government, they are not that much serious into it because it's a chaos as of now. In a quarter, you see 150 something people dying, but there is no mechanism to at least support the system. So maybe in short, I can just say we are still looking for resources and also well-wishers who can also help into our interventions so that we can use our local model. We use our local model of training the local people within the community so that it should be peer-to-peer. If you train someone in the community, they will be able to understand him than a certain person coming from somewhere. But if you train someone from there, you'll be able to link up to his fellow men or his fellow women. That's how it goes. Here, that's why we have introduced men groups where men, they are able to meet and also share some information. Thank you.
Yeah, fantastic. Yeah, keep the focus. Keep the focus and live it like you are. Your passion will make things happen with God and the universe, 100%. And you're battling up the hill, but there's more power in your community. I love that. And work with the community. And the other thing I just wanted to point out, question: how many cell phone companies are there in your country? 2, 3?
Currently, we have for the main one 4.
Yeah. What are the names? Any names I would know?
There's Airtel.
Yeah.
And we have for TNM, it's Malawi Telecom Communication.
Okay.
Yeah, and we have for MTL.
Are they private or are they government, or are they privately owned or big corporationally owned?
One of, like MTL is a government, it's a parastatal, but the rest are private. That's why we are also to launch a national hotline, but we are still looking for resources. But we applied to the government to give us a short code that we can be using as a hotline, but we haven't yet launched it because we don't have resources as of now. But we are still looking for resources to launch that helpline together with the life.
It'll happen. It'll happen. The reason why I ask you about the cell phone companies is because, especially the private ones, they're always looking for an edge of marketing. And if you can somehow, some way, sit down with, the CEO, CFO, some upper management, and make them aware that mental health is what it is, they can do amazing things like have a mental health day, and for all the text messages done on that day per year, that money goes towards your program. Not only that, this will help make them look like a good company helping the community. You understand it? You got to think in the you would go in there. You're telling them, hey, this is mental health in our country. Do you want to have more subscribers, more cell phone subscribers? This is one way. Make yourselves look like a company that's taking care of the people. Go in there and knock on their doors, get in there somehow. And, within months, you never know, you might strike up a deal and a partnership, because this has happened in other countries already. It's slow, but You got to start somewhere. But anyways, that I just wanted to point that out, and I feel that you're the man to do that. You got the passion for it. So
yeah, exactly.
take your team and make it happen, my friend.
Yeah,
Thank you.
William, this is a great idea. That's a great idea. I hope it will work because the level of greed in some of these companies in Africa is amazing, right? So that's why we need to account for the greed level. But I don't want to be negative, but this is a very, very good idea that if you can reach out to them and say, hey, we're gonna do this and um, it will really help your company um, in the nation that you guys are the only ones supporting on Mental Health Day and Suicide Prevention Day. So that's a good idea. Thank you so much for that great recommendation. Anyone else?
Dr. Mello, I'm on the phone. Can you hear me?
Okay. Yes, go ahead.
All right. This is Teresa. This is so informative and just educational. My question is there any issue beside what you listed with marriage, early marriage, and men being, the breadwinner and other social indicators? Is there a problem with drug abuse, use of illicit drug, let me put it that way, contributing to mental health in Malawi or suicide? I just want to know.
Yeah, that one is also here, but it has a very small numbers of cases comparing to what I have just shared. Because drug and substance abuse are much based on young people. And it's now much connected with the gambling, because gambling is now taking a huge space for youth to commit suicide here in Malawi, unlike the substance and drug abuse. So it is happening, but it's not that giving a huge number comparing with what I have shared.
Okay. Thank you for the response. What about women of childbearing age? I know you explain it so well, the differences in terms of the matrimonial and the patrilineal marriage ceremony, and in the area of women, regardless of which form of marriage they are engaged, do you have data to support women who commit suicide in terms of being, whether they are pregnant or postpartum depression? The reason this is my area where I did my doctoral dissertation, maternal mortality, but with great focus in Nigeria. And that's why I asked that question.
That's a great question.
Yeah.
That's very, very good question. Yeah, go ahead.
Yeah, we do also work in that area, especially for women. Fortunately enough, women here in Malawi, they are open up they have their groups, they do discuss, they are more open than men. So that's why when you look at the cases of suicide, it is the huge number is for men than women. But on issues of stress, anxiety, and other mental health issues, women are the ones who are affected. Many women are affected with mental health issues, but they are able to cope up because they do share their problems with their peer in the community, unlike men. But men, they do hide whatever it is happening on them, unlike women. I think that's where the problem comes in. But issues of childbearing, women maybe raising the kid from themselves, husband maybe run away, responsibility. Those are also some of the key issues happening to women. And like I say, fortunately enough, women, they are very open. They will maybe come to our organization. They will we'll make them to start village bank, what we call village bank. They contribute money and they share it maybe after 6 months. Then we train them on the businesses. They can able to start businesses, small businesses, and their life, it goes well than men. So that's what I can say about men and women, especially in the community here in Malawi.
Thank you so much.
Any question? Any additional question or comments? And Anderson, and also, by the
Hello.
way, you are not on camera. Go ahead.
Hello. This is Rosemond.
Go ahead, please.
Thank you, Henderson. Thank you
Can you turn your camera
Uh-huh.
on if you can, please?
Where I am, I don't think
Okay, that's
I
okay.
can.
Go ahead.
But, yeah, my apologies.
That's
Yeah.
okay.
Yeah, I like the presentation. Very informative, and yeah, listening to you confirms for me actually that country-specific research is needed. I had actually published an article that I titled "Placing Mental Health at the Center of Global Health Discourse and Agendas." It was a systematic review of global trends in adolescent suicide in the last decade. Being a university professor and teaching psychiatry and the law, my interest in mental health actually deepened. And I was looking at mental health as the center of health, placing it at the center of health. And what does that mean? It became very clear to me that the relationship is actually bi-directional. The relationship between mental health and health. Mental health and all that mental health, positive mental health and negative mental health, particularly negative mental health. If we want to deal with it and address it, then we need country-specific information that will enable us to do so and effectively. In this context, I just want to encourage Anderson that there'll be need for you to engage. I don't know who you are going to do that with, but stakeholders that share your vision for you to be able to advocate seriously to repeal that law. You talked about that penal law, the penal code, and I think that is going to work negatively. It's going to affect your work. It's going to affect the environment. I mean, if people are not going to be able to feel free and they will have to be arrested because they have tendencies to commit suicide, I think that is a negative. It's a negative environment, and you need to do that to ensure that that law gets repealed. Stigma is central. You realize that most people are very ignorant about mental health issues, negative mental health, and how that affects their lives and their health. You know, I, yeah, I have a psychiatrist doctor who tells me that we all have mental health issues, just the levels that differ. And so we are all affected. We are all affected, and the levels just differ. And so if we are able to create this awareness, that will go a long way. In all countries, when I looked at placing mental health globally at the center of health, there weren't notable differences so much regionally, globally. And so the issue is big. The issue is big, but how we approach it is what is important. And that's why, for me, I think the country-specific research and data is very important. I'm learning a lot today, looking at culture and suicide. And the issue of economics also came in somewhere along the line when Anderson was presenting his paper to us, and the intervention. You know, these interventions, I like it. The fact that it's local, the fact that you are harnessing local resources. And I would want to encourage you to look again at the hierarchy of health. You mentioned counselors. They are key. There are several stakeholders in our local environment that we can use. The only thing is that they have to be trained, and you need money for that. We need to train them to at least acquire basic knowledge and basic competencies that they can use to support, even if it means house to house. And then once you are in that vicinity, you are in that locality, and there is evidence that it works, the counselors are there. Even if there are pastors there who can be of help, you need to train them. Because sometimes the pastors and those who are ready to be of help, they have no expertise. Unfortunately, they don't. And they must be made aware that they need some kind of expertise to be able to help. And you know, the shortage of human resources and expertise it's not unique to Malawi. I'm in Botswana. And when I'm teaching my students, it's the same thing. We have in total only 12 psychiatrists in the whole country, Botswana. And we also have one hospital that you can call mental health hospital. But of course, for us, all the tertiary hospitals at least have nurses that are trained in psychiatry. And so when the first level counselors are not able to be of help, they are able to refer to the tertiary level of care. So that helps. But honestly, the issue is big. And the connection between poor mental health and suicide is clear. the correlation is there. And so we need to do something, and something quickly. And I think from listening to Henderson confirms for me that the local approach is the best way to go. Thank you very much. My work is actually available. It's published. So if anyone wants to.
Please, Rosemont, can you share your article on the chat? Can you put it down, or the link or whatever? But I have to say,
Okay.
you know what? Thank you so much for actually joining us, because you nailed that nail on the right place. The right place is that the basis of, can you guys hear me?
Yeah, we can hear you.
Okay. Yeah. The basis of public health, the foundation is mental health. And like I said, this mental health is underdiagnosed. Thank you for reminding us that we all have mental health issues. The level differs, right? So it's always important for us to recognize that. Everything you said is very, very fundamental, and that's where all my question cues into cultural integrity, cultural aspect. Definitely, we need as Africans to stop begging for information, begging for research. We need to start doing the research. Like you said, Rosemont, it has to be community targeted, community based, country specific, because most of the research you have to do, you need to realize that the environment affects human behavior, right? So we can actually start finding solutions to African problems. And the only way we can find solutions for African specific problems is to do as African or country specific research to be able to find that information. And thank you so much for all that information. You are absolutely 1000% correct. Thank you.
Yeah, I wanted also to comment on what my fellow colleague from, is it Botswana?
Yes.
Yeah. Mm-hmm.
Yeah, that mental health is for everyone. Everyone is actually a potential patient of mental health. And I think I remember last time when we were advocating for decriminalization in 2020, was an incident where the minister commit suicide right away in the parliament. He shot himself with a gun here in Malawi. And it was a very serious case. That's when people understood that mental health can affect everyone. Everyone can be a potential patient of mental health. And we need to look for each other. And we need to create an environment where people can able to express themselves and share information to each other. So I wanted to comment on that fact.
Thank you, Rosemont.
May I say something, please?
Go ahead, Dr. Manambu.
This is Manambu. Thank you very much, Mr. Henderson, for your presentation. I really enjoyed it. I gathered a lot of information about Malawi. My only concern, or what I would like to know more, is I can't pronounce it, but I'll try to pronounce it. It's called the Kikamiri type of marriage.
Yeah.
Yeah, where the husband has to move into the wife's family. I think that's will be a very stressful type of environment.
Yeah.
It is. Yeah, there's a
No, I'm not laughing as
based on what you described, where at times they get you to kick you out after you have built your house and things like that. Does the government do anything about that type of marriage to be able to reduce the incidence of the wife divorcing the husband and taking over the family property?
There's not much I think the government is doing, because it's based on the cultural laws. So, for example, when you want to marry, you choose. It's either you go for those type of marriage, you go for Christian marriage, you go for statutory marriage. So statutory marriage is the one which is regulated by government, while the cultural marriage are based on the cultural laws. So you have to be abided with those cultural laws. So that's why it becomes also a problem for government maybe to regulate some of the cultural marriage laws. They just follow the formality. You did a patrilineal marriage. What are the formality? What are some of the things they follow in the patrilineal marriage? So when you want to divorce, they'll check on those issues. So the judgment will be based on those principles. While on statutory marriage, that's when government has all the powers, because you go to legislate with the government.
Okay, thank you very much. In this case, what would be a very good type of intervention into this type of community to inform them about suicide and the tendency of reducing that incident of suicide in that community?
Yeah, I think that's what we have already started, engaging the chiefs, because they are the ones who can able to influence a cultural change. So on the dialogue, we invite all the opinion leaders in the community, at least to change some of the harmful cultural practices, which affect also people and prompt the negative mental health. So we are trying to engage the chiefs, and also we are trying to train men so that they can able to open up to their fellow men, to share information, so that whenever there's something happening, they are able to at least present themselves, whether to the chief's court and also other relevant authority within the community, so that they can able to be assisted.
Yeah, thank you very much for the information.
Have a wonderful day.
Thank you.
Thank you.
Thank you very much, Mercy. Thank you.
Thank you.